Little Gems Academy. Today our teachers will be engaging in a discussion on the topic assessment and intervention in relation to speech and language development observed in a 4-year-old boy named John. Today our presenters are Ms. Rihanna Shah, Ms. Vada Ramuta, Ms. Rupa Ramsarup, Ms. Diana Cooks, Ms. Marsha Smith and myself, Ms. Althea Mendoza Rivers. I will now take the time to provide the introduction. Firstly, let us explore what is a developmental delay. According to Boyce 2010, a developmental delay is when a child does not reach their developmental milestone at the expected time appropriate to their age range. Delay can occur in one or many areas, for example, fine or gross motor, language, social or thinking skills, which is correctly known as cognitive skills. Furthermore, assessment is used to support learning, identify special needs, for program evaluation and monitoring trends, as well as for school accountability, and to provide teachers with information that can be served as the basis for pedagogical and curriculum decisions, according to Assessment in Early Childhood Education 2020. Today, we, the teachers of Little Gems Academy, will be explaining the types of developmental delay identified in a 4-year-old boy named John. John is having difficulties pronouncing the sounding words. He also has problem understanding and or speaking. We, his teachers, have used various observational tools to assess John's development in determining the type of developmental delay he may be experiencing. We have also examined the best strategies needed to support his development, as well as great emphasis was paid on the long-term challenges John can encounter if the delay is not addressed as soon as possible. I will now submit to Ms. Rihanna Shah to share explanation on the type of developmental delay identified in John.
Welcome viewers. I will now give an explanation to the type of developmental delay identified in the child. John is a 4-year-old boy at Little Gems Academy who rarely communicates with his peers. He mostly uses notions such as nodding and pointing. He rarely speaks and answers questions with 1 or 2 words. It can be concluded that John is experiencing speech or language delay, as he is unable to express himself verbally or make complete sentences. As an early childhood educator, being observant is key in determining whether a child may be experiencing developmental delays. Children between the ages of 4 to 5, like John, experience or reach speech and language milestones such as the following. Children are able to say their full name and age, speak between 250 to 500 words, answer simple questions, and speak in complete sentences, as well as tell stories. John is 4 and struggles to meet these milestones. Hence, my colleagues and I came to the conclusion that John is experiencing language delay. I will now hand you over to my colleagues Rupa, Diane, and Visha, who will explain the samples of the assessment tools we use to determine the developmental delay in John.
I will inform you of the assessment tools which were used to assess John. We used anecdotal notes because they are very detailed and accurate. On these anecdotal records, we recorded behaviors, developmental skills, and incidents which happened in class, and how John was able to handle them. We also used checklists, which are also very clear and concise. Here, we recorded skills which John was reaching on the different developmental domains, and the skills and milestone John was having difficulty reaching. These records also helped us as teachers to improve on our instruction and strategies to work with John and to better advise his parents. John was assessed 4 times during the school year, upon entry at the beginning of the school year and every 3 months after that. I thank you, and I hand you over to Marsha Smith.
Hello viewers, I'll be speaking to you about reasons for using assessment tools. Anecdotal notes are concise, objective narrative about an incident or person. In classroom, teachers can write anecdotal notes recording the observation of students' behavior, skills, attitude, performance, and incidences that occur in the classroom as documentation. It must be noted that this documentation can be used to make a comparison about a child's behavior over a specific period. This information can be useful in making referral to the child's parents or physician. Additionally, anecdotal notes must contain authentic and factual information about a significant event, behavior, or learning outcome. Here are some tips which can help teachers to write good anecdotal notes. Pre-observation plan. Here, teachers must decide in advance which specific behavior and learning outcome they intend to observe and record. This helps teachers prepare and avoid confusion while recording. Teachers can decide when to observe to gain a balanced profile of their students. How often were the tools used and in what situation? These tools can be used on a daily basis to 1. Record qualitative information about students, identify student needs, behaviors, and learning patterns. For example, observing a child doing solitary play. The teacher must investigate what is attracting a child in that specific area of play. It could be the child may be lonely, sad, or maybe the child is throwing a temper tantrum. It therefore means that the teacher must observe closely, and as they do that, they will begin to identify the possible causes for this reaction. Observing a child throwing temper tantrum and record what triggers that kind of behavior. Track progress and changes in students' behavior and performance when generated over a period of time. Plan for activities and strategies to use in the classroom that help to alleviate disruptive behaviors in children. I thank you. I now hand you over to my colleague, Diana.
My name is Diana Pook, and I will be discussing the teacher observation checklist. The developmental checklist is one example of the teacher observation checklist. They are used to see the child's ability to reach certain developmental milestones. They are also used to identify specific behavior that the child should be demonstrating at a certain age. These checklists also allow teachers to consistently monitor and document progress or deficiencies in developmental growth. Besides helping identify the needs of the children, utilizing assessment checklists can pinpoint areas of instruction the teacher needs to improve when repeated categories show little progress for a large number of children. I have shared with you a copy of one of John's checklists that shows that he has a delay both in language development and emotional development. John was assessed with developmental assessment 4 times for this school year. He was assessed at the beginning of the school year and every 3 months after. This assessment tool monitors the progress of the child from the time he entered school to the present. It also helps in validating the fact that the child has a language delay. The checklist was completed over a 1-week period based on activities the child did and the observations made by the teacher in the classroom setting. This includes both the informal assessments and the anecdotal records. Every time the teacher completed the assessment, the parent was informed of the results, and the teacher explained to the parent the red flags seen in the child's language development. Now, Ms. Aldia Mendoza Rivers will be discussing the strategies needed to support the development of speech delay. Thank you.
Many strategies that can be used to support the development of the speech and language delay identified and determined on a 4-year-old boy named John. After utilizing numerous assessment tools, one strategy that can be used is communication. According to Julia K. Hanna 2019, communication is fundamental to children's development. Children need to be able to understand, and in return needs to be understood. Communication is also the foundation of relationships, and it is essential for learning, play, social interaction, which helps with learning and development. In dealing directly with John's delay, Firstly, as teachers, we need to inform John's parents or guardian about his identified speech and language developmental delay. Building a teacher-parent partnership is essential in giving John the support needed to improve his development. As teachers, we can engage John in age-appropriate conversation with positive talk, sing-along activities, provide individual attention to facilitate speech and language development. We will also have to encourage John's parents to work with him at home. Since John spends the majority of a day's time at home, his parents can encourage him in lots of talking, singing, encourage imitation of sound and gesture. For example, singing nursery rhymes at home can help to improve John's speech and language construction. Another strategy is reading. As stated by Reid 2010, reading helps children with speech and language problems to strengthen their speech and language skills. Teachers can read aloud every day with John, tell stories, follow John's lead, and spend extra time with John in the language and reading area to promote positive development. We can also encourage his parents to spend time reading aloud to John and ask him to name objects in the book to help build language development and improve words construction. An additional strategy is play. As postulated by Kimberly 2016, play enables children to practice the language skills they have learned and build on their expanded vocabulary. Teachers can engage John in games like finger play, tabletop games, play with appropriate toys, role play, or dramatic play, and also outdoor activities to interact with peers to help refine his speech and language acquisition. Encourages parents to play games such as practicing turn-taking, sharing emotion, also choice of game chosen by John. Interaction is a vital factor in supporting language. Children who have limited opportunity for interaction will often have immature speech development. Overall, play helps with the holistic development of a child. Final strategy is to visit a speech therapist. How can John's speech and language delay be diagnosed if he might have a problem? It's important he see a speech-language pathologist right away, according to Julia K. Hannett 2019. We, the teachers at Little James Academy, can work together with stakeholders and John's parents in seeking the most appropriate medical help for John. The Ministry of Social Development and Family Service, also John's family personal health provider, are mediums that can assist John in getting professional help from a therapist to determine his diagnosis. I will now hand over to Ms. Vada Ramita to share on the long-term challenges.
Thank you, Althea Rivers. Now that we have a fair idea of what speech-language delay is all about, I am here to educate you on the long-term challenges John will have if these delays are not addressed as soon as possible. According to Dr. McLaughlin of the University of Virginia School of Medicine, when a child is suspected of having speech-language delay, he should be referred to a speech-language specialist and an audiologist as soon as possible. Why, may you ask? The longer you wait for treatment, the more negative side effects this child can experience as he grows. It is encouraged to recognize the signs of speech-language delay before to avoid permanent damage. However, it must be noted that children's delay starts from as early as 6 months to 4 years. During these critical years, certain milestones are achieved. If these milestones are not achieved, the long-term effects are as follows. 1. Speech is delayed at a young age and can follow through into adulthood if not corrected. 2. The proper pronunciation of words will be hindered. 3. The ability to create conversations and sustain it. 4. The child will experience social issues with other children, the failure to speak properly and express themselves. 5. A delay in writing, reading, and a lack of attention span. And finally, children will have impaired communication and repetitive behaviors. So if John issues are not addressed as soon as possible, All these long-term effects are possible. Now I hand you over to Rihanna for our conclusion. Thank you.
Conclusion. Speech and language development is a vital component for children in the early childhood setting in order for them to learn and develop. Through communication, children are able to receive knowledge, share their thoughts and feelings, as well as their experiences. When this area of development is delayed, there is disruption in how children communicate and learn. As early years practitioners, it is imperative that we observe, assess, and find the right intervention strategies to help children progress. Working alongside parents is also necessary to ensure that they are taking the right steps to help children overcome their developmental delay. Thank you for listening to our presentation.